We live in an era of unprecedented awareness. We are all talking about self-care, mindfulness, and mental health more than any generation. In the midst of 2026, nearly 40% of Americans openly stated that mental well-being is a priority. However, awareness isn't the same as access. According to the World Health Organization, more than 1 billion people worldwide are currently living with a mental health disorder. Anxiety and depression make up a large number of these disorders, yet global investment in mental health care remains critically low. The pressure is close to home for many Americans. When surveyed, about 59% of Americans pointed out their anxiety toward personal finances, while the other half pointed to uncertainty about the future. People want to build healthy habits, better sleep, stress management, and regular exercise, but there is a divide in what people value and what they can practice. Tyler Evans, CEO of Wellness and Equity Alliance, notes that when you work directly with marginalized communities, you can quickly see the primary barrier to healthcare isn't a lack of medicine or passion.
They start feeding at 6:30.
Skid Row's waking up. A few tents, blankets, makeshift pillows, the occasional stained mattress, a square of cardboard, a styrofoam box used as a bed.
Housing is healthcare. If someone is experiencing housing instability, they are trapped in a financial cycle that makes it nearly impossible to access consistent life-saving care like those suffering from HIV and AIDS in homeless communities. This cycle also keeps people in poverty and creates the divide we see today between the healthcare needs of the rich and poor. The criminalization of poverty only further displaces patients who need help the most. The reality is a stark socioeconomic divide rooted from historical, ongoing discrimination and policies. Higher income adults report significantly better physical and mental health outcomes as they were backed by fewer financial burdens. Lower income populations fracture this narrative, and financial instability often lessens the chance for individuals to receive the care required, energy being spent on food and shelter. In vulnerable sectors, insurance rates plummet, which leave individuals exposed.
Report on childhood health.
These disparities overlap across race, income, and gender, leading to lowered life expectancies and higher illness and death rates for Black and American Indian populations compared to their white counterparts. Instead of using safety nets to bridge the gap between socioeconomic factions, the modern policy landscape is shifting. The implementation of the One Big Beautiful Bill Act reduces federal health care funding and restricts coverage for many Americans.
The One Big Beautiful Bill, and it will be the biggest bill ever passed in our country's history. It will include the biggest tax cuts, regulation cuts, military supremacy, and just about everything else. We will cut more than $1 trillion in wasteful and unnecessary spending. We will end inflation, slash prices, raise wages, and give you the greatest economy in the history of the world. The average family's take-home pay will be at least $5,000 more than it was just a couple of months ago.
Will include 100% expensing retroactive to January 20th, so you can build your factories right now, essentially almost tax-free. 100% expensing for companies investing in America. You buy a car that's made in America, you get an interest rate deduction. It's the biggest tax reduction in history, the biggest regulation reduction in history.
incredible for Medicaid, Medicare. We're strengthening it. If we don't get it, that means the Democrats will have stopped us, and that means people get a tax increase, the largest in history. If we do get it, we're going to have the largest tax decrease in history.
The House just voted to advance President Trump's budget resolution, and this important step regarding the big beautiful.
An estimated 10 million people are on track to lose their health insurance by 2034, and millions more are at risk if tax credits expire and state Medicaid incentives vanish. In the midst of these government actions, places like Santa Clara, California, have been focusing from response to prevention. They have been providing small, localized financial aid of around $6,500 to families on the brink of homelessness, slashing that risk up to 70%. For students, between 2022 and 2025, depression and anxiety metrics have dropped significantly. But even among those struggling, financial reasons keep 60% from reaching clinical treatment. This endless cycle of trying to escape one's socioeconomic bracket only reinforces systemic poverty, widening the gap between healthcare available to the rich and poor. Wealth disparity determines far more than financial status. It dictates life expectancy, the severity of daily struggle, and access to essential medical care. Ultimately, the challenge is no longer about proving this connection, but finding the political and financial will to fund the solution.